Ted could need a total hip replacement. Now that's major surgery.
On this episode of Bondi Vet.
I am a little bit scared of reptiles. They give me the creeps. Treating one of these is a bit of a nightmare for me.
Lisa has to overcome a lizard phobia to help a goanna with a nasty gash.
Woo! I anaesthetised a lace monitor. But maybe the first and last time.
About a week ago, we noticed this big growth. It seemed to have come up really quickly.
Chris delves into his sewing box to keep a young wallaby from going deaf.
All of a sudden, everything begins to make sense.
All right, stingy one's coming up.
And Audrey must perform life-saving surgery on an 8-month-old.
That infection could spread into the bloodstream and that could be fatal.
As the young puppy's mum faces life without her best friend.
I can understand that Jordan is really worried and sad about Camilla because she's her baby.
You make my world a better place.
Come on, there's your girl.
I can depend on
In Sydney, Audrey is hard at work despite the city's COVID restrictions.
Aussie Mobile Vet has been really busy during lockdown. Care must still go on and a lot of people are staying at home and noticing all the things that are going wrong with their pets. Come here, oh, baby. I love you.
Among those pet owners is Jordan, who's worried about her French Bulldog, Camilla.
A couple of days ago, I noticed she just wasn't being herself. She was a little bit lethargic, not active, and was turned off her food, which is really unlike her. I love you. I love you. Camilla is very quirky, very needy, but she's like my best friend. She is my best friend.
Hi, Jordan. Hi, Camilla. Mommy, baby girl. How's she going today?
She's been better.
Yeah, a little bit better than yesterday?
A little bit, yeah.
Tests on an earlier swab taken from Camilla show she could have a serious infection.
Do you have that urine sample for me?
I do.
Excellent. All right, we'll test that, just rule out any infections in the bladder. So Camilla is an 8-month-old French Bulldog. I've seen her yesterday and we're worried because there's some discharge coming out of her vulva. I've asked Jordan to bring along a urine sample because I want to be complete and make sure it's not a urinary tract infection that's causing that discharge. So worst case scenario, she's got a nasty uterus infection. All right, so I'll take you to the hospital and then I'll give you a call with the results and we'll make a plan from there. All right, don't worry too much. All right, you want to say goodbye to Mama? Bye, Mom. Oh, I got my hair in your face. I love you. All right, let's go. Come on. Let's go.
I do want this day to be over with and just want her home, healthy, happy, and just back to her normal self.
Audrey tests the urine sample and her worst fears are confirmed.
Just as we thought.
Instead of in her urinary tract, Camilla has a potentially deadly infection in her uterus.
This has progressed so quickly, infections can spread and it's an emergency. If we don't go in today, she could potentially die.
For Jordan, the thought of losing her best friend is unbearable.
Camilla means more than anyone knows.
You can understand that Jordan is really worried and sad about Camilla because she's her baby.
Audrey must perform urgent surgery to remove Camilla's infected uterus.
So uterus infection is called Pyometra and it's quite serious in a dog, especially a dog as young as Camilla. It's when the uterus fills up with pus and becomes infected, and potentially that pus or infection could spread into the bloodstream and that could be fatal. Okay, let's take some blood. What's happening back there? Nothing. Nothing to see there. All right. That's it. Okay. Good girl.
Audrey hopes the blood tests will rule out other serious health issues and provide some good news for Jordan before surgery begins.
Hi Jordan, it's Audrey from Mobile Vet.
Hey Audrey.
Everything's going well, so we've taken some bloods, I popped her onto fluids and we're just starting her antibiotics now, going quite well. Now the blood results are actually pretty good, so her white blood cells are normal. She's a little bit anemic, but that's not unexpected with some infection. Her liver and kidney function is great, so I think the anesthetic should go well, and I think that we've caught it pretty early. So I'll give you a call when we're done.
Okay.
Okay.
All right, cool.
Breathe in some oxygen. Good girl.
But despite the encouraging blood results, the hysterectomy surgery is a risky procedure.
She likes it. Camilla is a French Bulldog, and aside from the fact that she really needs the surgery because of the infection, her anesthetic alone is going to be quite risky. French Bulldogs have a squished in nose, and that makes them difficult to intubate for the anesthetic, but also we have to be careful with the type of drugs we give them. All right, stingy one's coming up. Okay. Okay. Dun. Oh, I'm sorry, that one stings so bad, I know. Stress fart, that's okay, happens.
Sorry, I know she's
Finally, Audrey is ready to begin the delicate operation to remove Camilla's womb.
So I'm starting the incision and I'm expecting to find a big uterus in there. Maybe full of pus, maybe full of a little bit of pus. If it's early, that would be great because it means we got it in time. It is quite inflamed. There's a lot of blood vessels going around that uterus. That uterus is looking a lot larger and inflamed compared to what it should look like. The inside of that does feel like it's got some thick pus in it. So we're going to have to be quite careful today, just making sure when we remove it, none of the infection goes into the abdominal cavity. That infection can spread to their bloodstream and they can potentially die from it as well. Poor females, always getting the shortest straw. So I've tied everything off, and so it's the final step. We're going to cut the cervix or uterus out of the body. So just in the nick of time. I'm really happy with how Camilla's surgery went today. It was successful. We managed to remove the uterus and the ovaries, and I can see that uterus is filled with a small infection. So hopefully we got it in time and early. Okay, so that's the last stitch done. It's going to heal really nicely, so we can wake her up and bring her home to mum. Wakey. You want to go home to mummy? I feel really great that we can return Camilla back to mum safe and sound. She's really dodged a bullet today, and I'm happy that we got there just in the nick of time. Good girl. Can you take you home to mama? Oh no. Come on. I think Jordan's going to be so excited and happy to have Camilla back. She's been really, really worried, and this is the best part of my job. Oh my God! Look who's here! Hi! Hi, Mama. Look, Mama's here.
Hi, Mommy.
Everything's gone well. She's not liking her little bucket cone, but she'll get used to it. Couldn't have gone any better. We got there just in the nick of time. So she should recover well. So antibiotics in her fluid line today, and also antibiotics to go home with.
Okay.
So Camilla's case really highlights the importance of desexing your pet, as well as the behavioural problems and the unwanted pregnancy. For us, it's the medical issues. Infection, breast cancer, those kind of things are really important, and we are starting to see it a lot more as people are delaying desexing or stopping desexing altogether. I know, this big thing's in the way, isn't it?
I know. You're ready for bed. Thank you, Audrey.
Hi, I'm here to see Chris. I've got a wallaby.
Okay, great. If you just want to take a seat in the waiting room behind you.
No worries. Thank you.
At the Bondi Clinic, Ben has travelled from the outskirts of Sydney with a very special patient.
This is Hugo. He's a redneck wallaby. He's about 4 years old. And he's from a wildlife sanctuary that I run out in Dural. And we've just noticed in the last week or so that he's developed a really large lump, tumour-looking growth in his ear. So it's a bit concerning how big it is and how quickly it's come on. So we're keen to get it checked out by Chris and see what he thinks it might be.
How you doing, mate? Come straight through.
Thanks, mate.
Bag's wriggling, huh?
It is moving a bit, yeah. Puff him up here.
Yeah, that'd be great. So I'm just trying to keep stress to a minimum because I'm sure he's probably realised this is a bit out of the ordinary.
Come on, buddy.
All right, big bag and big wallaby, huh?
Definitely, yep.
Yeah.
Yeah.
All right. We might just try to get him out nice and gently.
Come on, matey.
Oh, mate. That's Hugo, isn't it?
Hugo's his name, yeah. He's a redneck wallaby.
Okay.
And about a week and a half ago, we noticed this big growth that had come up in his ear, so it seemed to have come up really quickly. And it's very large, as you can see.
It's big, I mean, and it's also really filling up the entirety of that ear canal there. And quite firm too. The moment I look into that ear, it's very clear exactly why Ben's worried. There is a big lump in there, and it sounds like it's come up really quickly. So there are really two extremes. At either end of the scale, we have an abscess, which really isn't such a bad thing. We can treat with antibiotics and it should heal, through to the other worst possible case scenario, which is a tumour.
So he was bred in captivity, and when he reached sexual maturity, he started to get a little bit boisterous. So they had to rehome him, so they gave me a call.
Yep.
So yeah, he came to us, and we've had him for about 8 months now.
Since he's been with you, has he been quite calm?
Initially, it was quite interesting to see how he reacted with the other roos. So he sort of came in, and I think he's got a bit of small man syndrome, being the wallaby, and there was a few big red kangaroos, twice his size around.
Yeah.
And he had to sort of prove himself to them, but pretty quickly they put him in his place. So of all the roos we've got at the sanctuary, I think, Hugo's probably one that I've got the closest bond with, and I think that's got a lot to do with his really outgoing personality. He's just got a lot of character, and he's always sort of jumping around and causing mischief around the sanctuary.
Yeah, the challenge is if you have one lump, you just want to make sure you don't have two.
Yeah.
And so I'm going to great lengths to feel all over him there to make sure there's nothing else that shouldn't be there. Okay, I'm pretty comfortable there's not. What this clean bill of health for the rest of him means is that I can really now start to focus just on his ear. The logical thing is to try to get a needle in there and take a sample.
Yeah.
And that's at least going to start to narrow down the options in terms of what it could be.
For sure. Come on, matey.
Okay, so this is just to clean up the skin there. So, I'm not sure if it's the right jab or the left hook I need to worry about, but let's just see how we go.
It's all right, I've got your back.
So I'm going right in the middle. If I put the needle in and draw back pus, we're looking at an abscess. If I put the needle in and draw back not much at all, apart from just a bit of tissue, then I'm concerned, because that could indicate we've got a tumour in our hands. Okay, immediately we're getting blood there, and quite a bit of it. Yeah, wow, okay, I did not expect that.
Boy.
All right, well.
What do you think?
Yeah, that's a surprise. After the initial shock of seeing the blood in the syringe, all of a sudden, everything begins to make sense. Hugo has blood in his ear, an oral hematoma. How do you get an oral hematoma? Well, if you're a wallaby, it's from fighting. What does Hugo have a reputation for doing? It's getting these out. It's the same way a boxer gets a blood clot like that.
Yep.
I'd say he's copped a stray right hook. He's actually been boxing with one of those big red kangaroos, and they've landed one on him.
Okay.
The thing is, we can't just leave a big blood clot like this in Hugo's ear. What happens over time is the fibrous tissue in the clot starts to tighten down like it does in a scab. When it does that, it really shrinks down all the tissue around it and really causes what is essentially a cauliflower ear. If that happens in Hugo's ear, it'll really render that ear useless for him, and ultimately he could become deaf as a result. So this little brawler has suddenly had his personality catch up with him.
Hey, it puts you in your place, mate.
Yeah. So really what I think we need to do is to get in there and remove that blood clot. Now, I obviously can't do that with him awake. What I need to do is to give him a sedation and make a little cut on his ear and see if we can actually pluck that clot out.
Okay.
How do you feel about that?
Well, if it's got to be done, definitely I want to make sure he's happy and healthy long term. So if it's going to affect him long term and he's going to lose that hearing, then yeah, ultimately I'd rather get on top of it now before it gets any worse. So.
Yeah. Something a little bit different. So Hugo isn't aware of his size, but Hugo likes to use his fists for bad reasons.
Oh, well, everyone likes a bad boy.
Yeah, well, he's that.
Out in the waiting room, Hugo's keeper Ben is worried about his little mate.
There's a lot of risks involved in sedating a wildlife species, so I'm a little bit concerned, but it's got to be done, so yeah, I'm sure it'll be fine.
So that's another 9 mils I've managed to get out there, so that makes a total of 15 mils of blood that has come out of this ear of Hugo's. What we're really left with now inside his ear is essentially just blood clot. So this is the stuff that's going to cause him problems. Okay, I'll get all cleaned up myself and then get started. Hopefully what this surgery achieves is to remove the blood clot that's in there and also bring those layers of skin back together and seal them against the cartilage of the ear.
Okay, so the challenge here is to incise into this blood clot without actually starting a whole lot of new bleeding. So I'm inside it now and it's very firm. I'm actually having to spin it around and really break down scar tissue. The more I can break up of this clot, the more chance we have of actually stopping this cauliflower ear from forming. We've got an area above it where there was the lump before. Now that's skin that's lifted off the cartilage. We need to really anchor that back onto the cartilage, otherwise it's a space that's just going to refill with blood. So in order to do that, I've got a little bit of a trick up my sleeve. Kind of literally up my sleeve, because what's up my sleeve is what I'm going to use.
The solution to this problem, it's not exactly high tech. In fact, most of us are carrying around the solution every day of our lives. The answer to all of Hugo's problems is buttons.
The ironic thing is, I can't put buttons back on my shirts. Hopeless at it. But I can put buttons in animals' ears. Somehow it's different.
The key to the buttons' success is the fact they really provide a flat surface that you can anchor onto the inside of that ear and attach in place. Once it's there, it makes sure the skin is firmly fixed to the cartilage.
So the challenge is just getting it nice and firm, which it is. Okay, then we've got room for one more. So I'll just put that in that space there. Okay, so we've got 3 buttons in there. I'm pretty happy with how that's managing to really compress those layers of the ear together and prevent blood from filling in between there, which is ultimately what caused the whole problem to start with. The one thing I'm worried about is the fact that with those claws of his, he can actually get his foot up and push those buttons out. What I'm thinking is I'm really gonna have to bandage his ear just to stop that from happening. Okay, we are done. Let's wake him up.
Now the procedure's all done. Hugo looks $1 million. It's time to wake him up and get him home.
What have you done?
Now all the lovely lady wallabies will know who that hot piece of tail is.
Liesel's decided that the feminine touch is really the key to Hugo's future. I'm not so sure. It stands for hot man with buttons, right?
I was going for Hugo, but yeah, that's the other interpretation, of course.
Yep.
Keeper Ben has been waiting patiently for news of Hugo.
Yeah, definitely been watching the clock tick by. It's been almost an hour now and we haven't heard anything, so hopefully they'll be coming out soon with some good news, I hope.
So?
Oh no. Hey big boy.
Here he is.
How'd he go?
Look, he went really well.
Yeah.
Yeah, he came through the operation brilliantly.
Okay.
So he's just waking up now. I guess I've got him out to you a little bit earlier than we normally do.
Yeah.
Just so he is still a little bit sleepy when he goes home.
For the trip home? Yeah. Cool. Big surprise to see his ear all wrapped up like that. I love the little touch with the H and that was very nice. And great relief just to hear that the surgery went really well. I think we'll have to find him a girl one day.
Turn this fighter into a lover.
Alrighty. Thank you very much, Chris. Really appreciate it.
No worries at all.
He'll be fine. I'll let you know how he goes.
It'd be great. And if we can see him in a couple of weeks for that, get those buttons back.
Great, thank you very much.
Safe trip home, huh?
Thank you.
There's no doubt that Hugo goes home a lot more colourful than how he came in, but my hope is that he finds that special someone and his days of fighting are all over.
Today I'm on a beautiful drive out in the countryside to see one of my favourite people in the world, Jill, who runs the Border Collie Spot. She's given me a call because she's just received 2 beautiful Border Collie puppies. So she wants me to have a look at them, and of course, when Jill gives me a call, I come running because I love this lady. Jill is a saint.
Curly, Curly.
She literally saves hundreds of Border Collies in the UK every year.
Border Collies are my favourite breed. I love their intelligence, their loyalty. They're real friends. I mainly take dogs from farms that are neglected, unwanted, abused. Hopefully I can help them and give them a better life. Good boy.
Hello, gorgeous Jill.
Hi, Scott.
How are you, lovely lady?
I'm fine, thank you.
Ah,
Yeah.
so who is this?
This is Mia.
Hello, Mia. Aren't you a pretty girl?
And this is her little brother, Ted.
Jill's 2 new rescue cases are 7-month-old siblings. Ted and Mia were found emaciated and riddled with worms. But it's the little boy's lame back legs that are Jill's main concern.
Such sad, sad dogs arrive here sometimes, and although sometimes it takes a long time, it's wonderful to see them recovering and the light coming back into their eyes. That's, I suppose, why I keep doing it.
OK, Jill, so I need to see your little boy do a bit of walking.
Okay.
So do you want to walk over that way?
Come on, Ted.
Go on then, Ted.
Come on. Good boy.
It's not normal. Not normal at all. He's very stiff on that back leg, isn't he?
Yeah, it's not right, is it?
It really is a very concerning moment when a young dog is lame and limping on a hip that should be completely healthy. They should be bounding around, and he isn't. And that really worries me for his future. OK, I'm just going to extend this hip here.
Yeah.
Good boy. There's definitely something going on in this left hip.
Yeah.
There's a bit of clicking. He definitely resents me extending that hip. Ooh, does it hurt a little bit? Eh? For a young dog of his age, you know, he should have very flexible, very mobile hips, and this one, there's definitely some tightness. So I think that's probably the cause for his lameness at the moment. It's painful. He can't fully extend it. And in the worst case scenario, it could be something like hip dysplasia, where the hip just falls out of the socket. So what I think we need to do is take this young man to go and see my mate Michael, the orthopaedic surgeon, get him to have a little look. We'll do some examinations, likely x-rays, and look a little bit deeper into what the problems are.
Well, as long as we can do something.
Yeah, here we are again.
Yeah. The news Scott usually brings to me is that something is going to need major surgery and cost thousands of pounds that we haven't got. But even so, we always manage to find it. So no dog ever goes without treatment if it needs it.
Okay. Get you into the car, hey? Go see Michael.
Ted's been through so much, had such a terrible start to his life.
Say bye, Jill. Hey.
Hi, Ted. Good boy. And hopefully, if we get some good news today, he'll get into a loving home of his own.
That's it. Lovely. Good boy.
Bye.
Let's go see Michael. Good boy.
Near Marlow in Buckinghamshire, Scott has arrived to ask orthopaedic specialist surgeon Michael Hamilton to check out Ted the rescue pup.
I know, it's a Geordie. I know. It is a bit off-putting. Come on.
But the 7-month-old is definitely nervous about seeing his second vet of the day.
Come on. In you come. Come on. Oh, you're going to make me carry you, aren't you? Come here. Come on. Sleep. Come on. Hello, mate.
Hello, mate. Good to see you.
And you, and you. So this is Ted.
Yeah.
He's from Ireland. How's your Irish accent?
Poor.
Yeah.
Poor. Fairly poor.
Me too, me too. I can drink a Guinness and that's about it. This guy, he is walking quite oddly on his back leg, on his back left. Today is a massive crossroads for Ted's life. It could just be that he has a slightly tight hip, that's a muscular issue that will resolve with physiotherapy or hydrotherapy.
Yeah, he's getting a bit tense there.
Or it could be as bad as a hip needing a total hip replacement. There's a massive spectrum there. We need to find out where on that spectrum he is.
Right, okay.
Come on, Ted.
Let's go.
Let's go for a run. Good boy. Come on, then.
To further assess Ted's hips, Michael needs to put him through his paces.
Good boy. That's it.
So the reason we've come out here is we need to see him at a faster speed and then ideally in a nice straight line. And this works perfectly. It's little runway number 1.
Keep going. Good boy.
Yeah.
Good boy.
Go on, keep going, Scotty.
That's it, good boy.
And a bit quicker.
Good boy. Hope you don't find anything wrong with me.
Come on, Ted. He's got what I call the Supermodel Swagger. So as he moves, rather than kind of pulling his hip through, he swings his whole pelvis forward. So he kind of walks like he's got a pair of Christian Louboutins on. Let's X-ray his hips. Let's see how good or bad his hips actually are.
Ted's swagger could be the result of poor diet or a lack of exercise, but the main reason why young dogs like him walk like he does is a condition called hip dysplasia. That's where the ball literally falls out of the hip socket joint over time, and that causes painful rubbing of the joint.
X-rays.
If that's the case, Ted could need a total hip replacement. Now, that's major surgery requiring weeks of rehab.
These X-rays will give Michael and Scott the answers and decide Ted's future.
So this is an X-ray of his hips. So these are the balls of the ball and socket joints. The balls are basically sitting quite well in the sockets. Yeah, I mean, his hips are actually pretty good. I guess he could still snatch defeat from the jaws of victory, but you know, they're pretty good. So I'm really glad we did that. I can only assume that some of his muscles and some of the soft tissues are just tight. Probably because he's had no exercise, he's had a poor diet, etc. But from a surgical perspective, there's nothing for me to do. There's nothing, no tendons to cut, no joints to replace, no broken bones to fix. So I think he's going to be fine. I think he's going to be fine. I'd be very surprised now, based on that X-ray, if he needs any intervention ever. So that's really good news for him. As he just does more and more exercise and becomes more and more of an athlete and gets a good diet, he's going to be normal.
Hello. That was a good little wake-up, wasn't it? Hey, lots of good news to tell you.
I think it's great news for Jill today. I think it's the chance that she can now find a forever home for this beautiful little dog, give him the future that he's looking for, and we'll keep a close eye on him to make sure that he does reach his full potential. All right then, mate. Well, thanks very much.
No problem.
Yeah, Ted says thanks very much.
Yeah.
While Ted is still looking distinctly worried,
Good to see you, mate.
See ya. Take
All the
care.
best, yeah.
Bye.
Scott can't wait to deliver the shy puppy back to Jill and give her the news she's been hoping for.
So it's rare, Jill, that I get to speak to you about good news.
Oh, that's good.
Yeah. The X-rays actually show that his hips are relatively good.
I was really nervous about what you were going to be saying to me, so it's really good news, isn't it?
So I think what we need to do is to allow him to grow, but also in an environment which is healthy, which is going to get good food, therefore good nutrition, and also exercise, which is absolutely key to develop physically as he should.
Yeah.
And my hope is that the lameness that he's showing at the moment will come right once he's just using his body the way it was intended.
Scott has given me the most amazing news. It is just a case of bad nutrition and neglect. So with care and love, he should recover well and hopefully be re-home soon.
I think if he was one of the 7 dwarfs, this guy, I wonder if would he be dopey or sleepy?
Don't say that. He'll never get home.
Good luck finding that new home, mate. You deserve it. Good boy. Yeah. Mwah. Good boy. You love me, don't you? Yeah, you love me. Here you are. Yeah.
Ready, Teddy? You gonna spin? Good boy.
For Ted, all his Christmases have come early. He's found the perfect forever home with Border Collie lovers Dorian and Kim. and their other rescue dog, Kenny.
Oh, good boy. Good boy. He's very fast. You're very fast, aren't you, mate?
Ted was found starving and struggling to walk properly. But once Scott and Michael cleared the puppy of hip dysplasia,
so that's really good news for him. Spin.
It just took the right diet and care to transform him from a sad, quiet border collie to this happy boy.
Whoa!
Good lad.
Good boy.
Now Ted's repaying that debt by helping heal his new owner.
Kenny and Ted have helped me in a way that I cannot explain. They are... Oh, they're special. They're my little boys.
3 years ago, Dorian lost his eldest son, Connor, after the 21-year-old had a tragic fall from a balcony.
It happened. Every family's worst nightmare, it happened. And Kenny was actually born 3 days after Connor died. And it was like, wow, you know, it was just one of those things that we had to get him. Good boys.
First Kenny and now Ted have been helping Dorian through his profound grief.
Then I'll have 5 minutes walking my dog. Big bold bloke with a beard, crying over there with a dog, you know. But, hey, they don't know, do they? But I carry on, you know, and I look at my dogs and I just smile sometimes and get on with it, which you've got to do. You've got to do that. Teddy? Good boy. There you go. Another one? How many is that? 3? Another one? 4?
It's been a long journey for both Ted and Dorian, but this Christmas promises to be a very happy one for them all.
Good boy, Teddy. My advice to anybody that wants a dog is to go out and get one. Spin. Oh, very clever. You'll love it. You'll love it. It's life-changing. It's life-saving for so many people. You clever? Yes, you are clever. I know you're clever. I love you too, mate. Yes, I do. Yes, I do.
Hi, I'm Dr. Danny Dusek. If you love our show and want to see more amazing stories from the Bondi Vet team, just hit the subscribe button. Click that little notification bell and we'll see you for our next video.
Hey, Lise.
Yeah?
Guess what we've got coming down?
Oh, what?
A lace monitor.
A what?
A goanna.
Goanna?
Yeah.
It's coming down?
Yeah, just got a phone call. This guy is a pet goanna that's been attacked by one of his bigger ones. So the one that attacked him was probably about that big, and the one that's coming down, the one that's coming down is probably only about 1 kilo.
It's pretty bad. It's a couple of centimetres deep and all across from one side to the other.
Peter has a collection of 20 goannas at home, and one of the larger family members has attacked the much smaller 5-year-old Bally.
To be honest, I am a little bit scared of reptiles. They give me the creeps. And treating or handling one of these is a bit of a nightmare for me. Hi, little one.
You can't really trust him. I've been bitten by her actually a while back when she was smaller. I had to go to hospital for that.
I'm gonna actually, if you don't mind, take her out the back and get Jess, our nurse, to help me get that bandage off and we can take a look.
We're supposed to learn about all animals at uni, but quite honestly, all I can remember about lizards and reptiles are a few lectures we had back in 3rd year.
Yeah, if you can be comfortable that you're gonna hold her and that she's not gonna bite me, because honestly, I don't deal with reptiles very often and I'm instilling all my faith in you.
Okay.
Okay.
I used to work up at Australia Zoo, Wildlife Hospital, and we did a lot of lace monitors up there, wild ones, so I don't have a problem with a pet one. They're really cute as babies. Very, very cute. So they're just misunderstood. It's the claws and the tails that you need to watch out for in these guys, not necessarily their mouth.
All right. Now her tail, is there a spike?
No, they flick it really, really hard.
They just flick it hard.
Yep.
Okay, so I'm just gonna get like bruised from that and scratched and shredded from the claws. Fantastic. I'm a bit nervous. I'm looking.
I've got him.
I'm looking at his claws. I don't even like the feel of this.
Before Lisa can treat the severe wound, she wants to give Bally a general anaesthetic. Finding the right spot is proving extremely difficult.
Oh my God, Steph! It's not the easiest thing to do because you can't really see the vein. I guess if I was taking blood for a dog or a cat, I could feel the vein and I could see it. Here we're kind of going in blind.
There it is.
Yay! How good is that?
And then just hold it.
Woo! I anaesthetised a lace monitor. But maybe the first and last time. Right, hon, just take some deep breaths. Talking to a lizard here. Look, oh, she's really been ripped to pieces here. I see all the flesh and muscle right underneath there, so that big lace monitor has obviously come up to her and just taken a chunk out of her neck, and this needs to be stitched. I guess the main thing that I'm concerned about is infection. Goannas have got really nasty bacteria in their mouth and in their claws, and that bacteria can almost be venomous. It's that bad. So if we don't stitch up this wound and get her on some antibiotics, she can die from septic infection. How far down will we go? We've got to work pretty quickly here because they're obviously very sensitive animals, very prone to stress. The muscle under there is really shredded. The good thing is it doesn't look like it's gone through to her spinal cord. If it had, she would probably be paralysed, but I really need to fix up this shredded muscle and treat any chance of infection. Even though these reptiles freak me out a little bit, looking at Belly, I actually feel quite sorry for her. She has been bullied by a big bloke and she has copped a terrible bite. Thank you. All right, here we go. Her skin is really thick and tough, so I need to use a very thick suture material in order to close that wound. In a dog or cat, I would use something a lot finer. I'm trying to do neat ones so that she still maintains her attractive looks. And we're done.
Anti-inflammatory and antibiotic injections finish the lace monitor's treatment.
So just before she wakes up, did you want to give her a bit of a kiss on the nose?
I can't. I can't do it. You do it.
No?
Come on, kiss goodbye. You're awake. It's important for me to see her moving like this. It emphasises the fact that there's no damage to her spinal cord and she's recovered well from the procedure. I think now we'll pop her back to bed to wake up more. I'm feeling pretty chuffed with myself now. I think that all went very well. If another one came in, yes, I would treat it.
While Lisa is congratulating herself on controlling her fear of reptiles, vet nurse Jess is still not convinced.
Oh my God. You are evil, all of you.
She's still a princess until she kisses a toad.
You should be telling me how brave I was. I was so brave. Okay, all done. She was very well behaved.
Belly's going home after surviving an attack that nearly tore her neck apart.
Bye-bye. Who knows, maybe I'll become Sasha's resident lace monitor specialist. There's my role. But I'll never kiss one. That is never, ever, ever going to happen.
So Billy's in this one?
Yeah, Billy's in here.
A few days later, vet nurse Jess visits Peter's Reptile Resort to check up on Belly's progress.
It's a bit of a size difference here.
The patient is being reacquainted with Big Rex, who nearly tore the lace monitor's head off.
He's having a bit of a taste there.
Yeah.
Don't want any fighting going on here.
They're cold?
Yeah, oh, he's not very happy, is he? She's incredibly lucky. I think she should buy the next lotto ticket, maybe.